Good morning, everyone. Welcome to the final and last day of Coming Together for the Cure virtual series here with Parkland. My name is Shanette Cole. I'm the Director of Community Development, and I am excited about today's session. We have some great power lineups for this morning. One of the things that we will be focusing on for today's event will be about survivorship. What we will start with will be some additional information regarding from our clinical team, followed by a survivorship story from someone who has great insight. But before we get started, let's start with a video from one of our community partners. Welcome back. Thank you for watching the video. We're going to jump right into our educational series. We have two advanced practical clinicians here that have been with Parkland for over 20 years. We have Mr. William Rodriguez and also Julie Jen Pullman. What they're going to be discussing today is what is survivorship. After their educational series, we will then come back and begin to have a survivorship story from one of the individuals who have worked through the Parkland system as a survivor. Thank you.
Thank you. All right. Good morning, everybody. Thanks for being with us today. Again, we're nurse practitioners that work in the breast medical oncology on the team with them, and as also we are the nurse practitioners that are over the breast cancer survivorship program. We're just going to talk to you very briefly today about the program and what actually survivorship is. A lot of times when we first see patients in our program on their very first visit, they're a little bit confused about what it is that we're going to offer or what it is that they still need to continue on doing. And we are part of a group of clinicians that work with the patients. We not only continue to work with the patient's provider, you won't be seeing them as much as you did before, but we still work with the provider. But we also have a multidisciplinary team made up of nurse practitioners. There's the both of us and then one other nurse practitioner that works with us, along with dietitians, physical therapists, and social workers. So basically, you're sent to us in survivorship once you've completed your active treatment that your provider had planned out for you. When you come to us, then we start to see you and we set new goals for your future. And we do this again in a multidisciplinary fashion. The goals are dynamic; they're constantly changing throughout the process, and they're different for every patient. So some of the things we do, we manage any complications that might arise from the treatment that you had. And again, everybody's treatment is different. So some people have chemotherapy, some have surgery, radiation, a combination of these things. And we'll talk a little bit more specifically about that in a little bit. We also manage any breast cancer related medications that you're still on when you transition over to Survivorship Clinic. Usually the things that happen when you're in active treatment are things that we're doing to make the cancer go away. The things that we focus more on in Survivorship Clinic are medications that are used to decrease the risk of the cancer returning. Because once you get into Survivorship Clinic, you're considered cancer-free. And then we continue ordering any appropriate imaging that may be specific to you. Not everybody gets the same type of imaging. We order things like mammograms, breast MRIs, bone density scans, sometimes CAT scans. It just depends on your specific case and what is important to monitor for you. So things to expect during your survivorship journey. Again, everyone's journey is different. Yours is not going to be the same as maybe your friend or a neighbor or any person that's gone through this as well. Depending on medications that you're on, we focus on bone health. Sometimes you're on things called endocrine therapy that we give to certain types of breast cancer to decrease the risk of the cancer returning. These can affect your bone density and your bone health. So we order imaging that's appropriate for that. We recommend weight-bearing exercises, calcium supplements, those types of things. Body image and sexuality kind of go together. A lot of times there are alterations in this because of the treatments that you go through or the effects of these treatments. Some chemotherapies, you'll lose your hair. Some treatments will alter the hormones in your body, which may affect your sexual function. Sometimes patients lose a breast or both breasts. So again, this can affect your body image. We do have a new class that we're offering at Parkland now that specifically focuses on body image. And we also have a clinic through urogynecology that focuses on sexual dysfunction or sexual issues that come up. And then infertility, this is a bigger issue with patients who are premenopausal, of childbearing age, who still want to maybe have a family. So obviously there are options, things like egg preservation and medications that we can give to preserve the number of eggs that you have. But you would see a specialist for this also. A couple of things that we see in survivorship clinic that can be issues due to some of the treatments that you've gone through. Some patients have lymphedema, and this is just occurs usually when patients have a larger type of breast cancer surgery, when a larger number of lymph nodes are removed. You may see swelling of an upper extremity. We have physical therapists at Parkland that work specifically with patients that have this. We also are able to, as nurse practitioners, prescribe compression sleeves and garments that can also help with this. Nutrition, weight management, physical fitness, and exercise kind of all go together. We're lucky enough at Parkland to have dietitians that specifically work with our oncology patients, because a lot of times during your treatment process, nutrition, weight kind of changes, your needs change, your ability to do certain physical activities may change during your active treatment process. So when you get to nutrition, or when you get to Survivor Clinic, we do have specific dietitians that work with you. We actually have a class that our new survivors go to that specifically addresses exercise and nutrition in breast cancer survivors. And then we have a program through Baylor that we refer our patients to that's free to breast cancer survivors. It's called Fit Steps. And this is actually a place to go to use exercise equipment, exercise classes are there, and then actual fitness experts are there for you. And then our physical therapists also work with some of our patients who may experience range of motion issues following breast cancer surgeries. They help people get most of their motion back, sometimes all of the physical ability back in their upper extremities following surgery.
I'm going to talk briefly about survivorship visits. Your first visit, once you come off active treatment, is usually a longer visit. We usually have a 2-hour time slot to really get an idea of what your status, what has the treatments done to you emotionally, physically, and what can we do to help those problems you may be having. The first visit, you will see a nurse practitioner. We'll do a physical exam. We're going to ask you a lot of questions. We're going to get an idea of where you are physically and emotionally, and see what we can do to help you. We're going to see a nutritionist. We'd also like you to see our physical therapist and a social worker. The first visit is very important because it kind of sets the tone to what we need to do over the next 5 to 10 years to make sure that we address all your concerns and address all the symptoms you may be having because of the treatments that you've had because of cancer. So it's a longer visit. It's one of our more important visits, and it really tailors to your needs. It's not a generic visit. We try to focus everything that you're going through and address those concerns you may have. Future visits are not quite as long. Once we get a good idea of your needs, we can address them at the next visit. But every visit is a little different for every patient. As Julie said, everyone's journey through cancer care is very different. It's very tailored now, and everyone has different needs. Everyone has different types of, everyone can have different types of surgeries and treatments and chemotherapies. And because of that, at all future visits, we really have to direct your care towards what you've been through and what you need in the future. You always have a physical exam on your exams when your visits with us. We're going to order imaging when it's appropriate. We're not going to order everyone the same imaging because everyone has different surgeries and different needs. So depending on your specific type of surgery and specific type of risk, we'll order different imaging at your follow-up exams. And some patients do get blood work and some patients don't. Depending on what type of medication you're on, or if you're on medication at all, your oncology needs are different and from the other patients that you may know. So we don't need blood tests every time you come in like you were getting with your chemotherapy. So every test, every lab, every imaging will have to be tailored to your needs. And we'll address that every time you come in at all future visits. As far as how often we're going to see you, generically, we usually see our patients every 2 years. And it varies a little bit for certain types of cancers, but in general, we'll see you every 4 months. In years 3 through 5, we see you every 6 months, and that's pretty standard with us. But some of our patients need monitoring past 5 years. It's a very patient-dependent and cancer-dependent type of visit. If you need past 5 years, we'll talk to you about that. We'll have a plan after 5 years and see how often you need to be seen. But that's generically how often we see our patients. Of course, if there's always concerns between appointments, we're always available. We do utilize my chart with our patients and I'll get our patients in as they need it. And we do have a walk-in clinic that we can utilize. If we're not available that day for some reason, our patients have access to a walk-in clinic that they can utilize to make sure all their needs are taken care of as soon as possible. But generically, you'll be seeing us every 4 months for the first 2 years, and then every 6 months, years 3 through 5. So survivorship for us is very tailored to our patients. Everyone's journey is a little different, and we try to treat it that way. You know, your survivorship is different than any of your friends or family or relatives that you may know. And so at Parkland, with our survivorship program, we try to tailor your care and your needs specifically to you. And that's a little different than it's been in the past. So moving forward, this is our goal, is specifically to care for our patients, and we tailored the survivorship program for our patients' needs. That's really all we have today.
Well, thank you guys so much for providing that information. What we're going to do now, we have individuals that have already been asking questions. So since we have you guys seated here, we're going to go ahead and start right into those questions. And if there's anyone out there in the audience right now that has additional questions, feel free to drop those into the chat, and we will certainly ask those of our providers. So this could be a question for either of you guys. One of the questions that we received was, what do I need to tell my other providers about my cancer treatment?
That's a great question. Everyone needs to know what type of medication you're on because of potential interactions. Some of our medications have interactions with, like depression medication. So it's very important you let your general doctors know what medications you're taking and what you've been through. Certain types of surgeries and treatments, we don't like to use certain arms for blood draws. So it's important for you to understand what you've been through and make sure you express that to your regular doctors to make sure we're all on the same page of the medications you're taking.
Another question that we received was, when can I consider myself fully cured?
Well, usually when you're done with treatment, and that's the point when the provider will send you to the survivor clinic, you're considered cancer-free at that time.
Okay. That's a good question. I don't think I knew that one.
Yeah, that's confusing to patients because they come to us and they still think, I still have cancer. But no, they're finished with treatment. The doctor feels like, they can move on and they're considered cancer-free.
And that first visit with us, we do really emphasize that you are cancer-free and you're in the survivor program, and everything we do from this point moving forward is to reduce the risk of it coming back and not to treat the cancer that you had. And I think it's extremely important for patients to understand that.
That makes sense. I think I don't think I understood that until today. That makes a lot more sense. Another question that we got is, what do I need to tell my other providers specifically about the cancer treatment itself?
Like what William said, just what medications that we prescribe that could interact with other medications that they could be placed on by their primary doctor or another physician, because we don't want those medications to counteract what we're trying to do also, and then vice versa.
And what's important is at your first visit, at that first 2-hour survivor visit, we do actually give you a piece of paper with all your treatments that happened during your cancer journey. And it tells you what type of surgery you had, what type of chemotherapy you had. And that's really important to show your regular doctors, because certain type of chemotherapies increase your risk for cardiovascular problems later in life and things like that. So that is a document you will be given that's tailored to you specifically for your treatments and dates and everything that happened to you. And we provide that to the patients at that first 2-hour intake for our survivor clinic.
That's important to know, because I think sometimes we hear from the community that once people are diagnosed, they stop. seeing the other doctors for whatever reason, of course, because the cancer seems to be the priority. But it makes sense that we are providing them with information that they have to continue the care with their providers. Well, I think that is all the questions that we actually received. This was very valuable and informative information about survivorships. I want to thank you guys for listening. Again, if there's still additional questions that you have, feel free to drop those in the chat. What we're going to do now is play another video from one of our community partners, and we will be back with a survivor and talking to her about her story personally.
Thank you.
Welcome back. We hope that you guys really enjoyed the video from our community partner. I am back. I have a special guest with us today to continue with our efforts in educating and understanding about survivorship. I would like to introduce Ms. Deborah Horn. Ms. Deborah Horn is a 13-year survivor of breast cancer and also received her treatment here at Parkland. So thank you, Ms. Deborah, for coming. We have some questions that we would like to ask you regarding survivorship, and feel free to, engage us, give us information that you feel like the community would like to know. So let me just start by asking, how did you find out about your cancer? How did that diagnosis process happen?
November of 2008, I was having soreness in my right breast. It went on for a few months and then didn't think anything of it. So it got so sore. It got to a point where it got so sore that I had to position it. When I lay down at night, I had to position it on the pillow. So I made my doctor's appointment. And we did the necessary steps with that. I had an ultrasound, and then I had a biopsy. A couple of days after that, she called me into the office and told me to bring somebody with me. I knew then that it wasn't good news. The finding was I was in stage 2 breast cancer.
You said you were in stage 2?
Stage 2.
Okay. So how did you feel when you heard that?
I didn't know what to feel. I couldn't think. It was just numbness.
Okay.
I just felt numb at the time.
So once you got the diagnosis, what were the first couple of things that the providers here at Parkland started to talk to you about?
The first thing we did, they wanted to do everything all over again.
The testing.
The testing. I wanted to do the testing all over again. And the same thing, found the same finding, stage 2.
Okay.
They were so encouraging, very encouraging. And that helped a lot.
So who was in the process of the stages that you were going to? Who were the individuals that you were talking to here at Parkland?
I talked to Dr. Valerie Andrews, Dr. Lee, Nurse Williams,
How did they make you feel during the process?
They made me feel really good, and they was, they really encouraged me, and that gave me hope too. That gave me hope, and I really look, forward at seeing them, coming to see them when I came, because I already knew that there was always going to be something encouraging that they had to say.
So take me through your visits. Describe your visits coming here to Parkland Healthcare Center. Tell me, how did that happen? What did that look like?
First of all, it was scary because I'm not knowing what's going to be next, what I'm going to come, to. But once I look back on everything, the visits was fine. They was fine. I didn't have any complaints. We just sat all day sometimes, most of the time, but that's just not.
How did you talk to your families and friends? You mentioned that they asked you to bring a support person, but how was that conversation discussing that with your support system and the people that you talk to on an everyday basis?
I called my sister at first. We normally talk every day, but this one particular day, didn't neither one of them answer the phone. I had to call my brother. And I called him and I told him. And he paused for a minute. But then he says, Deborah, you're going to get through this. You're going to make it. And I called the family meeting and I told them, it hurt, but then I told them, it's one thing that we're not going to do. We're not going to throw pity parties for me. I don't want you to throw pity parties. I want you to treat me as if you treated me before I found that.
Okay.
And they were so supportive. They were supportive, encouraging, and uplifting. And we got through it.
It sounds like you had a lot of support from the Parkland side, and then also from your support system, from your family. They seemed like they were very encouraging.
They were.
So talk me through, as you were going through the treatment process, what were some of the things that you noticed that you changed about yourself, like some lifestyle changes?
I know that there was things that I couldn't hardly do that I used to do because I had lymph nodes taken out of my right arm.
Okay.
I tried to change my eating habits.
Okay.
I exercise, and it just make you want to stay positive about a lot of things. And it made me more of a loving and understanding person.
Interesting. So you talk me through some of the parts about the loving and the sharing, the emotions. What did you feel like now as a survivor when you were communicating with other women or other men at this point?
I feel now that I believe that there's somebody that I could touch in a way of, and there have been women that I've seen is just now going through it or in the middle of it, that I could tell them that everything is going to be okay. That all you have to do is have faith and put a joyful song in your heart and always think positive.
Give me one thing, if you could recap on that experience in the last 13 years. What is one momentous moment that you can think about in the 13 years about your survivorship that would be key for anybody?
To just push through it, just have the faith and just know that our sickness is not unto death. And just stay positive and just know that you're going to get through it and everything is going to be okay.
Okay. So tell me now that you're outside, there are some things that you're participating in. One thing that you're on our PFAC board, right, which is our Patient and Family Advisory Council. Talk me through, your experience of wanting to be and giving back and being a part of this particular board that we have at Parkland. Just tell me through how you started that process.
Well, I actually, Dr. Lee thought that I would be a good candidate because, the survivor time.
Okay.
And I'm like, well, okay. And I thought that was a great idea because I could talk with someone that's, that's just beginning, and I can kind of uplift them and kind of encourage them to know that no matter what, that you're going to be okay, and how to get through things that you have to go through. Certain steps like in chemo, could give them a little advice and how to, for instance, lemon water. It helps keep your stomach set, settles your stomach. Little advice and things like that.
So it allows you to give back and give tips that you learned during the process of being in Parkland and having the support. You can just drop those segments of love and appreciation to other women. That's good information. So right now we have some questions already, and those of you, if you have any questions for Ms. Horn, please drop them in. We will make sure that we answer those questions. So if you would give me a second, there's a question that we've already received. Did you face any obstacles during your treatment process?
Yes. The worst obstacle there was, I lost my place. I had to move in with my daughter because I didn't have a job. I lost my job. Of course, it couldn't work. But we got over that obstacle, and after everything, I was blessed with my job back and my own place to stay. That was the biggest obstacle that I had. I feel like I lost everything, but in a sense that I didn't.
Yeah, you gained more after the treatment process. So it wasn't the treatment process that was more of a hurdle, but it made it difficult for you to continue to work in those different types of days.
Well, at that time, I was at daycare. And I couldn't go back because of the kids. I did, they was having colds and things, colds and,
right,
and fevers, and I was told to not to go back to work. That was it. I can't think of anything else bad. I can't think of anything bad now that I look back on it.
Yeah,
I can't.
Okay. What was your support system during that time?
Faith, my family, and the team of doctors and nurses that I had, very supportive.
Okay. How would you describe in 2 words, if you had to tell the audience right now, maybe not 2 words, if you had to tell the audience right now, if they were to receive a diagnosis, what would you tell them in real time?
I would tell them that sickness is a mind thing. And you have to have that mind, strong mind, to know that you will get over this. And it's just a test of faith. That's what I would tell.
Okay. Well, you guys, that is actually the last segment of this week's Coming Together for the Cure series. We are excited. We have several events happening for the remainder of the month as we continue to make sure that there's awareness related to breast health. We will end this series in our community on this Saturday at Salem Institutional Baptist Church, where we will be doing mammograms in sunny South Dallas. We will also be here at our new location for our breast health center at Moody Outpatient Clinic as well. For those of you who have joined in for this week, we are glad that you joined. For those of you who may be watching this later, if you have questions that you have received after watching this series, feel free to email us at your convenience. If nothing else, we thank you guys, and it has been a pleasure to provide you with all this information for this week. Enjoy yourself.